Welcome to another episode of ThePrint's Virus Decode. I am Mohana Basu, and on Virus Decode, we bring experts from across the country to answer all of your COVID questions. The number of active COVID cases in India has fallen today, and several states across the country seem to have gone past the peak of the Omicron wave. While the Omicron variant does not seem to progress to severe disease for most of the patients, people living with comorbidities are still at considerable risk and need to take extra precautions. In this episode, we will particularly talk about COVID and tuberculosis, both respiratory infections. The government has now recommended that a TB test be taken for COVID-19 patients who have cough persisting for 2 to 3 weeks. So to answer these questions and to answer all of your questions, we have with us today Dr. Pradip Awate, and who was part of the integrated disease surveillance program of the Union Health Ministry and is part of the state surveillance program in Maharashtra. Along with that, is Dr. Shibu Vijayan, Global TB Technical Director at PATH. We also have Abantika Ghosh, who tracks health for ThePrint. Thank you all for joining us today. I would like to remind our viewers to please drop in your questions. I will try to take up as many as possible through the course of this episode. But before I go to audience questions, Dr. Pradip, what is the link between the two diseases and why is a TB test being recommended in COVID positive patients with persistent cough?
Tuberculosis and SARS-CoV-2 or COVID-19, these both diseases actually affect the lungs, and the symptoms of COVID-19 and tuberculosis are quite similar, though tuberculosis has relatively quite a prolonged incubation period, and onset is quite gradual, while COVID-19 infection is acute one, and the incubation period, as we know, it is now almost 3 to 7 days. But for TB, it goes in months. But naturally, the symptoms are similar. Even the mode of transmission is. The important aspect is both the diseases actually, it is necessary to test for tuberculosis whenever you are in doubt of COVID-19 also, and that is.
Sir, can you just go over that last sentence? I think we got muted.
Yes, please. Hello.
Yeah.
Am I audible?
Yes, you're audible, sir. Can you just repeat what the last sentence that you said? That's where we lost you.
Yeah. Basically, what I am telling, that in a country like India, where the incidence and prevalence of tuberculosis is quite at a higher side, as a country, we are contributing to the 26% of the global prevalence or incidence of the tuberculosis and 38% of the mortality due to tuberculosis. So naturally, it is one important public health problem for India. That is one thing. Second important aspect is that due to COVID pandemic, the entire surveillance focus is shifted towards the COVID-19 itself. And what it has hampered is the tuberculosis surveillance. Because if you look at the data of January 2020 to June 2020, the decline in the TB notification is to the tune of 26%. So that much less number of cases have been reported in India as compared to the last year. So naturally, somehow due to COVID pandemic, we are missing a lot of tuberculosis cases. And that is why experts have now asked to go for TB testing in certain situations based on certain criteria in COVID-19 cases.
Right. Right. All right. Thank you for that, sir. Coming to you, Dr. Shibu, for a person who, for a layman, say, what would be the differences in the symptoms of someone suffering from TB versus someone suffering from COVID?
So as Dr. Pradip also mentioned, the TB symptoms, both symptoms overlap. Cough and fever are the symptoms which is overlapping. And the duration of cough or duration of fever and associated symptoms is actually what is differentiating between these two diseases. Broadly, I'm just saying there is no kind of a clear line saying after 1 week this could be tuberculosis. But classically, tuberculosis symptomatology, we know it's likely prolonged, like 2 to 3 weeks of cough, and then fever, weight loss, and kind of night sweats. These are classical 4 symptoms. And that is why the government of India also, before ICMR coming into play, in September 2020 itself, government of India TB division has actually issued guidances to search for tuberculosis among COVID patients, among influenza-like illness, among people with severe acute respiratory illness, because this is an opportunistic way of catching up with the case detection, right? Because we know that, as Dr. Pradip mentioned, there is a shift towards COVID, and how can we mitigate? So look at opportunities where we can get it. And later on, the TB control program also shows that there is, as we know, that within SARS-CoV also, there is a direct viral action, virus acting in your upper respiratory infection and lower and in lungs. And there is an immune play, right? Okay, there are 2 phases of it. The immune play also actually kind of undermines our immunity, which actually increases our risk to from infection of tuberculosis breaking down to disease. As Dr. Pradip rightly said, we have a high prevalence of TB infection in our country. It is estimated that roughly around 40% of the adults are infected with TB. That means we all harbor, pretty much nearly 40% of Indian adults harbor TB bacilli in our body. That doesn't mean that we have disease. So this probably kind of actually the immune challenges which is posed by the SARS-CoV-2 will kind of increase the vulnerability to breaking down that into disease. And we also have a vulnerable population, right? Okay, so as we see, the COVID is affecting mostly on the vulnerable population like elderly and comorbidities. Comorbidities like diabetes is again a risk for TB disease breakdown. So it's actually kind of adding more risk onto the top of the TB disease and with a crisis health system. So that is where the play of active search for COVID among TB, TB among COVID plays out from an opportunistic standpoint as well as from a scientific standpoint, because it's a challenge in your defense mechanism.
Right. Thank you for that. Abantika, coming to you, we did in the beginning of the pandemic also, you did report about how, the surveillance of TB cases were sort of affected. But also from the patient perspective, how was, how was treatment affected among TB patients?
So, see, TB, the DOTS program, it requires patients to come to the center because, see, TB has a very long, the period for which you have to take the medication is very long, and because of that, there's a very high dropout rate. India also has a very high burden of drug-resistant tuberculosis, and that can happen when sort of patients don't complete the full course of treatment and they just drop out. So the virus basically gets an exposure, the bacteria, too much talk about virus these days. The bacteria gets enough exposure to the medicine to sort of, not to get killed, but it gets enough exposure to mutate and evolve and just become resistant to that drug. So that being the case, there was this thing that you have to come to the center and it's directly observed. So you have to pop your pills in front of a healthcare worker. So there was a lockdown, people could not travel, there was, and the lockdown was not like the curfews we are seeing now. I mean, all of us have seen it was really bad in those days. So that kind of got hampered. Also, we do a lot of active case finding. Now, healthcare workers, and Dr. Awate would actually, I think, can give us more details on that, but we have a limited number of healthcare workers, and COVID came to us suddenly. So we really had to push a lot of people who were doing TB work into COVID in the initial days. That also, caused us to miss out cases. So, which is actually why sometime back, with the lockdown in mind, the TB division had actually brought out guidelines saying, please give your patients drugs for a whole month so that they don't miss out because they can't travel. So we did things, but still there was a huge gap. People were reluctant simply, people who had cough for a long time were reluctant because there was so much fear already about COVID. They wouldn't go and get tested. So a lot of things happened. I think while all our resources were mobilized towards this one disease, not just TB, many other diseases also suffered. So yeah, we have quite a bit of lost ground to cover when it comes to TB.
I will come back to you about the other diseases that are also that should also be highlighted, that got sort of ignored during the pandemic. But I do have some audience questions coming in. So, if Dr. Pradip will take this one, this is from Asad Ali. He's asking, increased and sustained testing has been a core tenet of battling COVID. For TB, where stigma already compounds health-seeking behavior, how do we effectively ensure testing in pandemic times?
Actually, in pandemic time, we have decided certain criteria for testing tuberculosis among the COVID-19 cases. So what we are actually using, we are using 3 different kind of modalities for tuberculosis testing. And for lay person who need to be tested, so there is basically group of 4 symptoms which actually should draw some conclusion that this particular person might be having tuberculosis along with COVID-19. That is, one is cough more than 2 weeks, persistent fever more than 2 weeks, then significant weight loss, and night sweats. So these 4 symptoms are important, and along with that, if the person has the history of contact with a TB case, that is again some important evidence that we should go for testing in this particular case. So there is basically bidirectional screening of the COVID cases and COVID and TB cases. That means the persons having COVID need to be tested for tuberculosis, and person having tuberculosis already diagnosed under treatment should go for COVID testing. So that is a bidirectional testing we are using. That is one thing, because as we know, there is 2.1-fold more chances of getting COVID-19 in tuberculosis cases. And different studies have shown that the incidence of tuberculosis among COVID-19 is near about 0.37 to 4.47%. That means near about 5%. So that is why this bidirectional testing of both the patients for another disease is important. Is one thing. Then second thing is testing cases with influenza-like illness having these 4 symptoms predominantly for tuberculosis, and at the same time testing cases with the severe acute respiratory infection or illness for tuberculosis. So we are using these 3 different modalities, which are actually ensuring that we are laid down the criteria for testing, and that will definitely help to increase and identify the cases of tuberculosis among this COVID-19. And especially during this pandemic, we can actually use our resources judiciously to identify the TB cases.
Right. Thank you so much. I hope that answers your question, Asad Ali. And, going to you, Dr. Shibu, we do talk a lot about like throughout this pandemic, we have actually seen that while the guidelines do come in, it does take a long time for this information to sort of trickle down to the layperson. And even though, like, we can expect, say, for example, a government facility to be complying with every guideline because it gets communicated better to them, how are we ensuring that the private sector also follows these guidelines, considering that a lot of people will end up going to private facilities?
Yeah, so that was not a straight answer. So, I mean, even if like for the government, it is not very straightforward. There is an intention to, find out more TB cases. That does not actually stop there. Where are the instruments for this? Do we have bump up capacity? Because this is actually more number of patients need to be screened, right? Okay, so it includes a lot of training, a lot of procurement of new machines to actually catch up with it, a lot of integration of your testing services. Like, okay, you can use the TrueNat machine or a Gene Expert machine for diagnosing both. So I think this is not just a directory. This also requires logistics management, training, human resource, and functional labs with the airborne infection control, which applies for private also, right? So what we have seen in India over the last 3-4 years, there is a significant increase in notification. Major chunk of it, roughly around 700,000. I mean, that 7 lakh of the patients got notified from the private sector, starting from 2018-19 onwards. Because 2019 we have seen a peak of around 24 lakhs patients getting notified per year, and we've seen that a dip in 2020 to 18 lakhs, and then in 2021, we have seen that catch up to 21 lakhs, so roughly around 2 lakh patients. And among that, around 30% is kind of getting notified from the private sector. But the private sector services also was affected during the lockdown. Lockdown is, I don't account for lockdown because there is a lot of limitations for accessing services and when running the services. So one of the best way to actually, and this attempt of government of India in a systematic manner to engage private sector has been now utilized to, I don't say utilized to large extent, but utilized to some extent. And by sourcing the service from the private sector, like there are guidance documents which actually clearly define how do you procure private diagnostic services. So there is if there is enough resources available, enough intent available with the state government for the district TB mechanism or district health missions, there is no dearth in policy or guidance document to do that. So there are states that have done that by procuring, because one of the states is Maharashtra. They have actually rampantly procured, utilized the private sector resources during these times, because it's not only it's a matter of access also, because as Dr. Pradip mentioned earlier, and you asked the question, how do the stigma and all these things? One of the issue with the stigma is actually if we don't have access, then you don't mean that actually further stigmatized. So by engaging private sector and utilizing that pragmatically during this time, because it's again an opportunity to kind of increase your reach to the patients, and that itself, because people go to private because there is a trust factor. That trust is also embedded with the destigmatizing behavior or some sort of barrier mitigation is there. So I would say that utilize the government of India guidance generously, negotiate with your district magistrate or mechanism to get the services. As a public and TB activist, you should also actually reach out to them and amplify the voices of TB patients as also as general health patients to seek the services, because don't see private as an enemy. And these are all the same doctors trained by the medical colleges approved by government of India, which is trained Dr. Pradip and me. So use that services. Half of your strength is outside the private, and we have the intent to do it and guidance document to do it. Let's go ahead and do it.
Right. That is a good point. What matters is the intention at the end of the day. Dr. Pradip, I have one question for you. basically, how what made what made this decision happen at this point? Were we seeing a lot of cases of COVID, positive patients later testing positive for TB, or because why did this notification not sort of come in the earlier waves?
Actually, this decision was taken on the background that during the pandemic, TB notification has decreased significantly. So policymakers and the program managers are of the opinion that due to pandemic, definitely we are missing some of the cases of tuberculosis. Then, as I have said, different studies internationally pointed out that among the COVID-19, near about 0.5 to 5% cases are actually having tuberculosis. So naturally, this is a huge number, because when we are reporting COVID-19 cases in lakhs, it is basically 5% of that figure is not a less number in absolute numbers. So naturally, we need to diagnose them at the earliest. And as other experts have also expressed the concern about the multi-drug resistant and the extensive drug resistant tuberculosis. And we are getting near about now more than 9 cases per lakh population in India. So naturally, when you diagnose the case late and put it on the treatment in a delayed manner, it will again lead to drug-resistant TB and all those things. So naturally, it is necessary to identify and diagnose the case at the earliest. And that is why this decision was taken.
Right.
If I can come in and ask Dr. Pradip a question. Sir, I'm just seeing right now that some schools in Mumbai are asking students to submit RT-PCR tests on a daily basis, on a weekly basis. Is that, are they allowed to do that under the guidelines? Is that necessary?
Actually, it is not necessary to test students in a weekly manner. But as you know, we always discuss about the cytokine storm whenever we discuss about COVID-19 or influenza H1N1. This is basically the societal cytokine storm. Sometimes people overreact to the things.
Right.
But in infectious diseases, they always say, like epidemiologists say, that if you overreact and then nothing happens, you probably did the right thing. It's the other thing that we don't want. So okay, coming back to you, Abantika, we did talk about how the disease surveillance was affected, and how patient treatment was affected. So are there any other diseases or any other conditions which got similarly affected during this time?
Yeah, I think we discussed that a while back also on this program. Cardiovascular diseases, cancer care, anything, even diabetes, anything that requires long-term either long-term treatment or anything that requires emergency care. I mean, emergency care was severely affected regardless of the treatment. It was very difficult for people to get to hospitals at that point of time unless you had your own vehicles. So all those things have been affected, were affected. Then there were reports, as we mentioned earlier also, about women not being able to access contraception because of the lockdown and all of that. Immunization has been affected. In fact, we're talking about TB. There are reports that suggest that, so BCG is one of our oldest vaccines in the program, in the National Universal Immunization Program. And children missed out on their BCG shots even. And that's, immunization, overall our immunization rates dropped a little bit. So as in the immunization coverage dropped a little bit. So there were many other things, both preventive and therapeutic, that were affected, and the effects of which we will see over the long term. But I think we keep coming back to TB because of the huge burden and the fact that Prime Minister Modi had committed in 2018 that, instead of the global goal of eliminating TB by 2030. India will do that 5 years earlier by 2025. So all of those things taken together, I think TB has probably emerged as something where we have a big backlog, but there are many other diseases where we have similar backlogs.
Right. I'll come to you, Dr. Shibu, with this question about how should a patient who, what exactly should a patient who has recovered from COVID and then tested positive for TB, what should they do? What should their, course of action be?
And they should stick on to, actually, one thing is what is important is they have to consume their medicine as prescribed by their doctor. So that is adhering to the drugs is far more important. And also kind of, because see, I mean, COVID-19 also poses a lot of immune challenges. So I don't want to kind of give a loose message and say, okay, you carry on with your daily routine. So this needs a little bit of clinical intervention here. So doctor intervention and advice is critical. And go and get an X-ray done, because if it is because that also gives you underlying the extent of the disease and kind of actually help the patient in post TB. There will be a lots of lung damage. So probably some of the respiratory exercises and rebuilding of your respiratory muscles, breathing exercises, which is important if it is already damaged. And then if there is a delay in detection, because that is quite possible in the in this situation where the patient might have missed in the first instance of getting notice of tuberculosis, because there was no proper guidance saying you check for TB. So probably they might have missed it. So they might have actually kind of diagnosed as COVID and then might be thinking that this is all due to COVID. So I think any patient which is actually having a prolonged symptoms need to get consulted, get an X-ray done. So this is for the doctors actually. So X-ray is the best tool to understand how the lungs is behaving, and then go for a TB rapid test. And that gives you two advantages. One is TB diagnosis as well as drug-resistant TB diagnosis. Then you follow your prescribed regimen. I'm not prescribing you have to get treated in public only, but again, we have enough number of private doctors also. But again, just be aware that all these services are available at free in public also. So I mean, there is no special mantra for this thing, but again, I would say there is a little bit of extra caution for post-COVID because of the immune damage that might have been done.
Right. A last question to you, Dr. Pradip. I know you are a busy person, you have to leave, but who are the people who are more at risk of co-infection with TB and COVID?
Basically, the people who are at risk for tuberculosis infection are having malnutrition. At the same time, there are some occupational hazards regarding tuberculosis. So certain occupations are also actually hazardous for TB infection. Along with that, the people who are living actually in a quite a dense areas like slums and all those things, because when we go to the per lakh population TB cases, overall average is 190 plus per lakh in a 1 lakh population. But when you go to the slums of Mumbai, it is more than 500 cases per lakh population. So naturally, it seems that the people living in a unhygienic conditions, in a dense population and malnourished, having some kind of addictions like alcohol and all those things, they are more prone for such kind of tuberculosis infection.
Right. All right. Thank you so much, Dr. Pradip and Abantika. Closing comments from you. Do you think that this guideline came a lot late into the pandemic? It's been 3 years, and should we have stepped up this effort a lot earlier?
Yeah, perhaps, but you see, this has been a very difficult 2 years, let's say, for healthcare, and so we did come out with the bidirectional TB and COVID screening guidelines quite a bit earlier. This is a sort of an extension to that. Actually, more than sort of faulting the timing, what I would really emphasize is the need to ensure that this reaches everybody, all, treating doctors, all healthcare workers. It's the dissemination that is now going to be crucial. It's one thing to bring out a guideline, but it's quite another to ensure that your target population actually gets to know that this needs to be done and follows those guidelines. So that is the crucial factor, I think, going forward.
All right. Thank you so much. Thanks to all the panelists for taking all the questions, for giving us your time. And I hope all the viewers have a better sense of what these new guidelines mean for the patients, for COVID patients at large, and for TB surveillance as well. As you know, that's how I started this episode, that we do have new guidelines now saying that any COVID patient who has persistent cough for 2 to 3 weeks should now get tested for TB as well. And I do hope that you were able to get a lot of insights from this episode. Do join us again tomorrow at 6. We will be back with another episode of Virus Decode, and we will discuss questions around the COVID and pandemic, and hope to see you again tomorrow. Thank you so much.
Thank
Thank you.